Good morning. Welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. Joined with Adam Thacker today, who's our Chief Operating Officer at Good Samaritan Hospital. We'll be giving you our usual weekly update, talking a bit about what our current numbers are, also talking a little bit about what testing is, some of the evolution of what we're seeing with that and considering. Also, discussion about precautions moving forward from where we are now. And ultimately a little bit about what's coming in terms of treatments and what we're looking forward to in terms of vaccine coming out over the next few months or so. So starting out with numbers, things are kind of exploding, I guess would be the best way to look at it. And unfortunately with viral infections and the methods by which viral infections spread, we're seeing a tremendous increase over the course of the past couple weeks or so. And just looking at number of active cases, now over 150, somewhere around 170 active cases that we have in the community. And then that number that we frequently go back to, which is the number of positive individuals within the unique individual population, is around 27%. So an incredible increase in that over the course of the past few weeks or so. The important thing to consider is it's very, very, very important that we all look at those numbers and realize that what that means is we have more individuals in our community that have contracted the illness. Therefore, there's more likelihood for spread. And even though we have asked for vigilance over the course of the past several months with everybody in terms of their hand washing and mask wearing and precautions, never in the past has it been more important than it is right now, really.
Right. As you mentioned, the positivity rate of 27%. So, 1 in 4 individuals that we're testing are testing positive, and that just puts the emphasis on the social distancing, the masking. Governor Holcomb's update this past week talked about whether there would be, as the state is seeing an increase in cases and record days of positive cases being reported across the state. Certainly, Southwest Indiana is kind of leading that, unfortunately. So this is not just a Knox County, but really our region has been a hot spot within the state, if you would call it that. But puts that emphasis on individual awareness of, are we wearing our mask? Are we staying spaced out? Are we following hand hygiene as we move into this season? And for those that, I get the question commonly, are we going to go back to restrictions? Are we going to go back to a shutdown even? I think there's a lot of emphasis from a political standpoint from our leaders, elected officials, that don't want to move towards having to put those restrictions in place, but it becomes an individual responsibility. If we're not following those guidelines and we continue to see that positivity rate go up, the action will be that things will be shut down and restricted in some way, whatever that is determined to be. So that individual responsibility is never more important than it has been since March.
And I think it's important to realize that a lot of the states have realized that looking at things from a state standpoint and saying blanket statement, we're going to shut down an entire state, doesn't make as much sense as looking at it individually. And as Adam was talking about, when we look regionally or within our district, it's really going to be up to us and our partners within that district to say, hey, we need to shut down these services. We need to look at this as far as restrictions are concerned. And I think we're right on the edge of that right now. So it's very important to realize that that's something that has changed dramatically over the course of the past few weeks or so, and it is all rate dependent based on the number of cases that we see and then how we see that spread within our community.
I think an important note is we're talking about, we've really seen an increase in the positivity rate. Active cases at 170 is the highest number that I can recall us having. Is that here at Good Samaritan, the number of patients in the hospital requiring that level of care has been maintained pretty consistently, and our resources from ventilator, ICU, staffing capacity, we're able to continue to meet that need and have that ability. And then across District 10, which is our Southwest Indiana region, we have additional resources, even though we're seeing a lot of positive cases across the region. So don't connect the dots that a high positivity rate and a number of active cases that's at our all-time high means that our hospitals are being overwhelmed. They certainly are busy, but we're coming into a busier season regardless of COVID, and now we're adding that to it. So certainly busy, a lot of processes around handling the number of patients, but we are managing to do that and still have resources available to provide care.
And what that essentially means is we have more individuals who are having the illness, but not necessarily seeing the severity of the illness that we've seen earlier on. one of the things that's important to review that maybe we'll take just a few moments to go over today is how to deal with that primary contact issue, because I have this question nearly every hour of every day, which is my child, my spouse, my family member was around somebody as a primary contact, meaning that they had close contact with them for 15 minutes, and that's now a cumulative number that we look at, unprotected, and what to do about that, because the numbers are kind of confusing. The individual that turns up positive gets quarantined for 10 days. The individual who is a positive contact to that individual gets quarantined for 14 days. However, during that time that they're in quarantine, if they develop positive symptoms, then they are quarantined for 10 days from that point going forward. Right. And that's kind of confusing, but we have to keep in mind the incubation period. If Adam has it and I'm exposed to him, I'm not instantaneously going to have the illness. There's an incubation period that may be for a few days up to a couple of weeks. And so it's important to realize during that period of time, if you happen to be a primary contact of somebody who has had a positive test and has had symptoms, or you're in that 14-day quarantine period, that during your 14-day quarantine period, if you develop symptoms or turn positive, it's at that point in time that your new quarantine period starts, and that period is for 10 days.
We have our triage line here at Good Samaritan. Certainly the health department resources, our testing sites are all good resources for being able to help to walk through, okay, when does that clock start? When does that clock end? One piece to always keep in mind too is even in that 14-day period, as you mentioned, if symptoms start, even if you don't go get tested, if symptoms start, it doesn't end until you're 72 hours symptom-free, seeing that improvement. And certainly if symptoms worsen, then we would advise that you go get tested. But that direct exposure is a question that comes up quite a bit. So the quarantine and isolation is based off of direct exposure to somebody that tested positive within 6 feet, cumulative 15 minutes, which is a big change by the CDC from 15 minutes in one setting to now it's a cumulative 15 minutes. And then I get the question often, well, so-and-so within our household is quarantined. Does that mean everybody else is? I think that the appropriate answer is if you can exercise, given our positivity rate right now, an abundance of caution and everybody can stay home and stay isolated, then that is ideal. But the CDC guidelines are whoever was that direct exposure is the quarantined individual, not others that then are in contact with them. But again, exercising caution, obviously if anybody develops symptoms, then it's an immediate need to isolate and help to drive that number down and be allowed to keep everything open and moving forward.
And as Adam said, it's very important. We realize that the majority of patients that are going to contract this illness will have relatively mild symptoms, and interesting, we still know statistically probably just a little bit less than half of them will have no symptoms whatsoever. Right. So it's important to realize that if you are displaying symptoms but things are relatively mild, we still recommend conservative treatment, which is stay home, stay hydrated, use anti-inflammatories, use decongestant medications as needed. But if your symptoms accelerate and we see more lower respiratory symptoms with more shortness of breath, what we call exertional dyspnea, which means you get up to do something and you get more short of breath than what you would normally expect, these are times that it's important to contact your provider. And we have the triage line that Adam talked about. We have virtual visits that we can go through either on the phone or on computer or on devices, and then of course in-person visits, and we try to keep an abundance of acute visits available within our offices, and then of course through convenient care as well. Right. Convenient care, bring that up, talk a little bit about what the testing is, what we have available there right now.
Sure. So our two main test sites from an ambulatory standpoint are at Convenient Care and then at the Medical Center of Vincennes. We did have some conversation last week, and as we have mentioned in weeks past, the nasopharyngeal swab test has been the gold standard for that 13 and older population, and then 12 and under the NARES swabbing. It's taken 2 to 3 days turnaround time, been really consistent with that and continue to see consistent turnaround time. But we did learn that some resources that are coming out from a state resource standpoint this week will add some availability for what we'll call rapid testing at an ambulatory standpoint. Now, those types of tests that are called antigen tests, they do not have the same level of accuracy as the nasopharyngeal swabbing, so they will be used only in certain populations. Yep. And that will really be the symptomatic population that looks and walks like a typical COVID patient that we know today, if there is typical, since this has only been around since January, but with the information that we know. And then there may be a confirmatory test using the swabbing, what's called a molecular test as well. So as that continues to evolve, we do expect to continue to see more rapid test turnaround times and the accuracy really drive up, even in that ambulatory setting. But we are going to be adding that in. The providers at the sites will make the determination based off of clinical appropriateness for who gets what type of test. It's not a patient decision. It is the providers and the clinical folks that have been trained and have the skill set to make that determination of what test is appropriate.
And it's important, as Adam just mentioned, it's really essential to look at how suspicious the symptoms are, because the validity of the testing is relatively good. However, when we look at the newer testing and rapid tests and things like that, the problem is those statistics get a little worse with each test that we look at. And so it's important to realize that the nasopharyngeal swab testing is still the best thing that we have. The antigen testing is the next best thing, and it's rapid, which is great. But really, if you are highly suspicious that you have the symptoms associated with COVID, the best thing to do is to quarantine yourself and conservatively manage yourself, and then realize that within your own household and within your own contacts, you need to make people aware that that's what's going on. Because with the numbers that we're seeing in the community now versus even just a month ago, the likelihood that you will encounter somebody who potentially has symptoms or has been exposed and may be shedding virus is going up.
And that 72-hour turnaround time mirrors, and while it's important for us to keep it under that 72, it also mirrors if you have symptoms, you should be staying at home regardless of a test result. And that holds true for other viral illnesses. If you test positive for influenza, you still can spread influenza. That can be up to a deadly virus for some individuals in the community that may have a difficult time recovering. So regardless of the COVID results or not, that 72-hour quarantine is important. So the rapid test, while we all want that answer and we want to know it right away, the symptoms trump any test results.
Absolutely. Adam mentioned influenza. We're really in the meat of the time period when we normally want to make sure that people get vaccinated. We've been very fortunate because the flu vaccine came out probably 3 or 4 weeks earlier than it normally would. There has been a bit of a paucity of the high dose available, but the high dose now has been available for people who are 65 and older for about the past week to week and a half. So it's very important that everybody get out, make sure that you get your flu vaccine, and there are lots of options for getting that. We vaccinated our entire population here and use that as somewhat of an exercise to see how quickly we can get vaccine out. The health department is vaccinating. All of our primary care offices and specialty offices are vaccinating as well. And then also within our retail pharmacies, they're vaccinating for flu, both the high dose and then the regular dose as well.
Yeah, our drive-through clinics, over the last couple of weeks, we saw just shy of 500 individuals, adult, come through the drive-through clinics, and then we had added on some pediatric options at the end of last week, as that was a question that came up often, and I believe over the course of about a month, including some of our MCV pediatric clinic, we saw another 500 plus being vaccinated. So again, if you weren't able to take advantage of some of those options, Dr. Stine mentioned there are still many options. It's never too late. You didn't miss the boat, and now I'm just not going to get the vaccine. It's still available, and we would still recommend that you get that, as we're on the increase front of influenza season, but still plenty of time to get vaccinated and have coverage all the way through the 2020-2021 flu season.
And bringing that up, especially with our young population, I have lots of people that I speak with every day that say, well, I'd never get a flu vaccine. Why do I need to get a flu vaccine? I'm young, I'm healthy. There are other compelling reasons besides just your specific health reasons, and that is that if you develop symptoms of influenza, which ultimately very closely overlap with what COVID is, you're going to be pulled out of your employment, you're going to be pulled out of work, you're going to be pulled out of service for a period of time long enough to determine what the source of that illness is. And so it's important to realize that there are implications beyond that, and also just simply spreading that virus amongst your family. So we are encouraging everybody, and even children, it's important that they get vaccinated as well. You can get regular flu vaccine down to the 6-month age range as far as kids are concerned. All of my children have been vaccinated for that. We did that with our children when they were that young as well. So it's very important to realize that that is safe, and it's important for all of us to do that to curb the spread of influenza. When we talk about vaccinations, of course, the question is, when is the COVID vaccine going to be here? What are we looking at on that? And I think it's important to realize that those studies that have been ongoing are continuing to progress. Things are looking good, and we anticipate that there will be vaccine becoming available relatively shortly. And we've been told to be ready really within the next week or so as far as distribution is concerned.
Our timeline from the CDC and federal immunization practice guidelines has been to be ready by the end of October. More recently, information that has came out has said that initial vaccine could be ready before the end of the year, maybe early in 2021. It will be a phased approach, and so that first phase is healthcare workers, folks that are on the front line of seeing COVID patients and are at the highest risk for in those patients also that have chronic illnesses that put them at high risk for a poor outcome. And then that phased approach is expected to stretch out the course of probably the better part of 2021 into next summer is when you will likely see that there's a vaccine that is available for mass population and be able to vaccinate everybody. As Dr. Stine mentioned, those trials are ongoing. Never has there been a brighter light shined on vaccine trials. So when you hear about a trial pausing or a participant in the trial that became ill, that has happened with every vaccine that has ever been approved by the FDA. It just stretches over 7 years and is really a non-media topic. And certainly it's a media topic today. So we continue to evaluate that information as it comes out through the FDA approval process. We'll have a better idea of exactly who may be excluded due to allergies or other reasons. We know children, young age, pregnant mothers will not be initially approved for the vaccine, but by the end of 2021, that may change as well.
It's important. We'd like to take a moment just to speak a bit about our frontline workers. We've had our nursing staff, our ICU staff, and our physicians that have been involved in these critical cases that are really working very hard, and we'd like to say thanks to all of them. These are difficult times. All of us feel the stresses of those, but nothing more than what our workers are that are working in the ICU, our respiratory therapists, our critical care doctors. So we really appreciate all the hard work that they have been doing. As we keep talking about, we're kind of on the front end of what our normal bad season would be anyway, and people are working very hard. So if you have family or friends who are in that line of work, if you have neighbors that are in that line of work, please reach out to them and thank them. They are really the people that are keeping things moving here at the hospital and taking care of these critical patients and working harder than they ever have. So thanks to all of our providers who are working in that critical setting, our nurses, our respiratory therapists, our lab, all of those folks, because we appreciate everything that you're doing. Any other things before we go to the phones?
No, I don't believe so. Let's see what questions we have.
No questions.
Surely. Surely not.
So I think you guys did a really good job talking about things today. I asked if anybody had questions, and only response was, "This is very helpful. Thank you."
Excellent. Well, I'll go ahead and be the broken record again. Individual accountability, wearing mask, social distancing, being thoughtful of where you're going out in the community. You know, we've talked a lot over the last few weeks about as weather is changing and we're going to be moving more indoors. We know that increases risk. I mean, the data proves that does. So just being thoughtful about that, and especially to those that are higher risk, older population, family, come together and help them out so that they don't have to go into those risky situations. Using virtual technology and all of the abilities that we have just to decrease that risk is really important. And it's going to be for the next 5-6 months. And then, we'll see where that comes into as weather starts to improve. But really have to stay very vigilant over these next few months.
And we are knocking on the door of upcoming holidays,
Yes.
Not the least of which, of course, is Halloween that's coming up this next week. And as we look into that, it's important to kind of look at what those activities are going to be like. Because as Adam said, I think we're all very cognizant of going to the grocery store and wearing our mask and going to our workplace and wearing our masks and so forth. But the masks that our children are going to be wearing for Halloween, probably not necessarily adequate for that. So we want to make sure that as we move into these upcoming holidays, that we're very cognizant of what that's going to look like. like. I think when you and I were growing up, it was the poisoned popcorn ball that we were looking out for, and and although that was never the case, we really need to critically look at how that is working over the course of the next several holidays that we enter. So please think about that. Think about family gatherings. Think about your family members that are higher risk, and think about doing some of that stuff at a distance.
Your Halloween costume should include a mask, so you have time to prepare for having a mask incorporated into whatever costume you have.
Yes. Looks like we've had something come up
Yes.
since the closing statements.
Some last minute questions. First one is, if you can't have a flu vaccine due to having Guillain-Barré syndrome, would you recommend getting the COVID-19 vaccine when it's available?
Probably not. And the reasoning behind that is Guillain-Barré is not well understood anyway. We know that it is inflammatory. We know that it involves the immune system potentially being overactive. And this is a balancing act where we look at the value of a vaccine versus the potential complications. So anytime somebody has had a specific allergic reaction or a specific neurological reaction after a vaccine, it will be a contraindication to getting the COVID vaccine because of that. So when we talk about why it's important that everybody gets vaccinated, it's that herd immunity that we're talking about. So if there are certain individuals that are undergoing cancer therapies, have immune problems, things like that, that won't be candidates for vaccines, one of the reasons that all of us are going to be getting our vaccine is to make sure that we're protecting those individuals. So an individual such as that, if you have had a specific reaction like that, then you would not be a candidate for the COVID vaccine.
Okay, and then this person asked, is it still safe to come to the hospital for testing such as a mammogram?
Yes. So we have had a lot of effort around making sure that all patients can receive safe care here at Good Samaritan and our sites outside of the main hospital. So when you come in, we're screening visitors and patients for symptoms, certainly patients that need care. We very much recognize that COVID-19 is not the only illness that needs treated. And so there is preventative care, maintenance care, as well as acute care that it's needed to be provided. So we have screening stations. We have our staff are masking and are self-screening every day for their own symptoms to make sure that those interactions are as safe as possible. We ask that everybody is doing that as well and self-screening even before you come to the hospital. Where there are virtual care options, then we look to provide those for areas such as if you're coming to the breast center or mammography, we have an entrance that you come in and go directly to them. We have spaced out seating in the waiting room. So we've taken all of those actions to make it as safe as possible, and certainly would advocate very strongly that nobody is delaying healthcare of any kind during this time, because the ramifications of that down the road can be quite significant.
And really, the reason that is much safer now than when we started was we know so much more about what the illness is and how it is spread and the precautions that work and the things that don't. So if we look back to March, April, and then reopening in May when things were kind of shut down, our knowledge base was very minimal at that time. And so really everything that we have implemented and then regionally what has been done is based on good science and good numbers that say if you do this, this will reduce the cases, this will reduce the spread. And from a provider standpoint, what I want to avoid is what Adam was describing, which is don't let all this build up and wait and wait and wait, because that delivery of healthcare on a daily and a weekly and a monthly basis is very important. We don't want people to stay away with regards to their COPD and emphysema and their diabetes and things like that, because what we saw early on is because everybody basically halted their healthcare, we saw a tremendous rise in other illnesses that brought people to the hospital and complications, heart attacks and strokes and kidney failure and congestive heart failure that all basically built up in those months that followed the initial shutdown, and we really want to avoid that. So it's important that you continue to stay in touch with your providers and continue to contact them and get in to be seen if you're having acute illnesses of other types, because we don't want to see that wave then come back and fall over us as it did when we were looking at July, August, September.
Yeah. If you have department-specific information, whether that be the breast center or a physician office, you can call our triage line, you can call the main hospital number and ask for that department as far as making sure you understand how best to have that care delivered in the safest way possible and help talk through any concerns that you may have. I think from a decreasing traffic at Good Samaritan, the one piece that I would add is We do allow one visitor. We've talked about visitation, I believe, every time. So we do allow one visitor across the continuum of care, whether that's a medical office or whether that is visiting on the inpatient setting. But if you don't need a visitor and can make that appointment by yourself, then certainly that's one less person that's in the facility and that is interacting. So where that's appropriate, if you need that individual, we recognize that as part of the care. But where you don't, then just be thoughtful on that.
Okay, I think that's it now.
Okay.
Second closing. Thank you all for being with us again. We appreciate it. We appreciate everybody being vigilant over the course of the next few weeks as we deal with this latest surge. Good hand hygiene, social distancing, masking, not only out in our community, but also when you're going to family gatherings. So thank you very much for being with us, and we'll follow up with questions afterwards.